Hi, everybody. It's Emma. I am a licensed insurance agent here in the state of Florida, and I'm going to be talking to you about Medicare enrollment periods. These are extremely important to help you navigate through the Medicare system. It can be quite complex, and there are different enrollment periods and special enrollment periods. So to understand that will help you avoid a lot of stress and also um, any type of potential penalties that may occur. So let's get started. The initial enrollment period, also known as IEP. The initial enrollment period revolves around your 65th birthday. Everyone turning 65 must enroll in Medicare, even if you currently have major medical. This period lasts for a total of 7 months. That includes 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months post your 65th birthday. Let's use July 1st as your birthday. You can enroll in Medicare starting March 1st of that year, and you must finish enrollment or be enrolled by September 31st of that year. It doesn't matter if you enroll in Medicare Advantage Plan or Original Medicare with supplements, you just have to enroll. When enrolling, if you're currently still working and have qualified medical coverage, you may only need to enroll in Part A, which is the hospitals. If you do not have qualifying health care coverage, you must also enroll in Part B for the doctors. When you retire from your job, you will lose your employer-sponsored health care. From the last day of work, you have 30 days to enroll in Part B. If you go beyond 30 days, you need to have COBRA coverage or you will be penalized per day that you don't have coverage for Part B. Signing up with Part B, the COBRA will cease. You can't enroll in a Part D without Medicare Part A and B. So you have to have those two to be able to qualify for Part D or a prescription drug plan. You can also get your Part D with Medicare Advantage plans or MAs, and you do not need to enroll in Part D initially. You don't even really need it at all, but you have to have Part A and B or a Medicare Advantage program to qualify for that. You will not be penalized for not having Part D. Open enrollment periods, OEPs. Open enrollment happens every year starting on October 15th and runs through December 7th. When you are in an open enrollment, you can change your plans. For example, you can go from original Medicare to a Medicare Advantage plan. You can downgrade from your Medicare Advantage plan to a original Medicare with supplements. And if you did not enroll in Part D prior, you can enroll now. You can also drop your Part D during this period. Now, general enrollment periods. This period runs from January 1st to March 31st of the following year. This time slot is designated for someone who did not enroll during their initial enrollment period, and you may incur a penalty at this time if you do not qualify for a special enrollment period or didn't have COBRA coverage for your Part B that you didn't add during the original enrollment period. Special enrollment periods, SEPs. Special enrollment periods can happen anytime throughout the year, pending a qualified occurrence. Things that can trigger an SEP are you qualify for Medicaid, which can help you pay for your Medicare coverage. You move. You go to a long-term care facility. You're diagnosed with a chronic illness like diabetes, dementia, heart attack, stroke, or other type of condition. If one of these things occur, you can change your policy with an SEP to better suit those needs. If you do have a chronic illness, you can qualify for SNP, which is a special needs plan. If you qualify for Medicare, you qualify for a DSNP, which is considered a dual special needs plan. If you move across town, your current plan may not be available in that area. So you've got to make sure you have your plan under control. This is where you would talk to somebody like me. This is where you talk to actual Medicare itself and find out what coverage you'll be able to get. Sometimes you get lucky and the plan still applies. You just need to update your address, but sometimes it just doesn't, and you need to change your whole plan. So as you can see, it can be a little bit confusing, but understanding these particular periods of time are going to be critical to help you get the most that you can out of Medicare and make it so much less stressful. That's what we're all here for. And of course, you are always welcome to contact me. I am Emma Dowd with the Emma Lynn Dowd Insurance Agency here in the Tampa Bay area. I do cover all of Florida. But you can contact me through my phone number. It's 800-587-6136. You can also email me directly, which is emmadowd@emmalindowd.com. You can also go visit my website, emmalindowd.com, and that has a link to all of my social media platforms that I would love to be able to see you there too as well. So, have a great day, everybody. Stay healthy, and I will see you on my next video.